my fair share of contribution that even makes them to be paid a salary.
All right, let's stay with that new directive by the Ministry of Health that it will be mandatory for Kenyans to have a coronavirus vaccination certificate to access in-person services in government offices starting the 21st of December. This has attracted lots of mixed reactions, as you've seen now. To answer some of those questions, with me in studio is Dr. Willis Akhwale, chairperson of the COVID-19 Vaccination Task Force. Dr. thank you for joining us just to clarify some of these matters. Now, with approximately a month to that deadline and having only a population of 8% fully vaccinated in this country, and I'll give you the numbers, 6.3 million vaccines have been administered across the country. Out of that, 3.9 million partially vaccinated and 2.4 million fully vaccinated. How realistic is this?
Yeah, thank you, Zainab, for hosting me. And I really want to start by making certain clarification. From the statement by the Cabinet Secretary, I think some of which has been, I would say, not put into context. First and foremost, his statement did not make COVID-19 vaccination mandatory. Far from that. That statement must be viewed from the fact that it puts in place measures that are for the public health good. Coming from a background that we now have upsurges in Europe. We are going to a festive season. People are going to travel. The potential of a fifth wave is here. And coming from the evidence that the unvaccinated are transmitters of the virus. So the measures that have been put in place, first and foremost, the first one is that there will be no in-person government services. In-person meaning coming to the government physically. But that does not stop you from accessing those services through telephone calls, through virtual means. We've been working virtually. That can still happen, because we need to ensure that crowding, which is a major driver of COVID-19 epidemics, is limited during this time of the season.
But Dr. I can only imagine that to a certain extent, some Kenyans will not be able to access, virtual services with the government, and they will have to walk in there. Does this mean that they have to walk around with their COVID-19 certificate, vaccination certificate?
Let me also really say this. The measures that were announced, you realize they cut across many government departments and ministries. Teams are working on the specifics of how exactly that will be implemented. So two things are happening between now and the 21st, specific guidelines on that by the different government ministries and departments. But for the people, it is also the period for you to go and get vaccinated, not to wait and see the vaccines are out there.
All right. You have an Amnesty International coming in and saying that this is quite coercive by the government. And I'll read you part of the statement saying, Amnesty International Kenya urges the Kenyan government to abandon what they call coercive and unimplementable mandatory measures announced by the National Emergency Response Committee on their 21st November update. Instead, the National Emergency Response Committee must accelerate an effective education program, to transparently address vaccine uptake and misinformation. They're saying that we call on the government to instead develop a clear framework, saying, this will lead to many people will now avoid going to hospitals probably for other treatments as well.
No, there's nothing coercive about it. Let me actually start by saying that all the other measures, including the education, we are doing it. In fact, we are scaling it up. We are using now more of the vernacular radio stations. We are working with the leadership in counties to educate. But beyond education, a good student must also do an exam and be certified. And for us, this is a pandemic. And the fifth wave could come anytime. We are in a festive season. There will be a lot of tourists coming here. The tourists need to also feel safe. Without certain measures, then we are also going to start losing in that front. It's a major economic driver. We see what the third and second and third waves had on our economy, and we need to avoid that. I think Amnesty must also realize that even certain rights will have limitations for the public good. If somebody who is highly infectious is going to be in a train going to Mombasa for holiday and infect so many other people, that cannot be said that has to be waited. In fact, I think Amnesty should be trying to ensure that the inequality on vaccines globally is what should be addressed.
But I think the question that comes to this with the statement from Amnesty International is, violation of human rights, the Bill of Rights, where, people are allowed to access services whether or without they have, been vaccinated against COVID-19.
There is also, I know the Bill of Rights, and I'm not a lawyer, but I also know there are certain limitations, especially in the interest of public good. And Cap 242, the Public Health Act, actually empowers the minister to put in measures. In fact, at the moment, he said, I'm not putting that, but he's empowered to put in even tougher measures.
Right.
Last year, you saw him ordering quarantine.
Right.
Yes. Now, in fact, what Kenyans should realize, we don't want to go to lockdown again. These measures are what is going to prevent us to go back. We will lose even more if we don't do these measures now. It's more preventive. Yep.
But Dr. 10 million target, a 10 million target by the end of this year, with only about 2.4 million Kenyans vaccinated at this point. How achievable is that?
Let me actually state clearly that our target is 10 million vaccinations by end of December and 26 million fully vaccinated end of 2022. Currently, we are at 6.4 million vaccinations. Today, in fact, I've just checked, it may be one of the highest vaccination we'll have. By around midday, 80,000 people are vaccinated. So if we start doing 100,000 per day for the next 30 days, and you add to the 6.4, we are very close to 10 million.
How viable is it? Do you have a clear framework guideline in which we can be able to follow to ensure that by the end of today, we have a certain number, we've hit our target in terms of the vaccination?
That's what I've explained, that especially from Friday, we are starting a campaign.
All right.
A mass vaccination campaign involving all counties that will run for 10 days. But that will include the education we are talking about, that it will include making the vaccines in marketplaces, in churches. That is going to happen. In addition, we are also going to really especially work with the faith-based and the leaders at the county level to ensure that that vaccination program continues up to the end of the year.
All right, maybe quickly, Daktari, we were expecting some about 4 million doses of the Pfizer vaccine. These were just for the 15 to 17-year-old demographic age bracket. Where are we on that?
Starting today, the vaccinations for teenagers aged 15, 16, and 17 has started. The 4 million doses of Pfizer are not specific for them alone. These are also for the elderly, and that continues to be our priority. Our priority is to reach the elderly who are most at risk of infection and death. But we also know that the young people, and now the regulatory approval has been given, they can get vaccinated. So those who are willing.
So how exactly is that going to be done in schools, perhaps?
At the moment, we are going to start with our vaccination centers. The teenagers can walk in with their guardian. They give verbal approval and they get vaccinated.
All right.
As we move ahead, we will work with the Ministry of Education and see better strategies to reach them, because we must know that they are the main carriers of the virus.
All right.
They may not be sick, but they cause the suffering of the elderly people.
Right. Thank you, Dr. Willis Akhwale, chairperson of the COVID-19